Okay, this video is chapter 10. I'm going to make it called chapter 10A because it's such a long chapter. It's almost like 50 pages long, this chapter. I'll divide it into several different parts. Okay, so this is chapter 10 from the book, The Medical Reformation by me. Here's the book again. And basically, I rewrote all the medical textbooks and corrected them. So we're going to talk about hypertension. The medical textbooks for hypertension are a joke. Pretty much anything to do with blood flow and atherosclerosis in a medical textbook is a joke. All right, so first of all, let's start out. There's two main types of atherosclerosis. The first one is your typical Westerner. Westerners, like Americans, they eat high-fat diet, and they typically get coronary artery disease, atherosclerosis in their coronary arteries, and they also get atherosclerosis in their internal carotid artery, right at the bifurcation. Common carotid artery comes up, bifurcates into internal and external carotid artery. So that's the high-fat diet type of atherosclerosis. Then the second pattern of atherosclerosis is called Asian atherosclerosis. And Asian atherosclerosis especially refers to, like, let's say the Japanese in the 1960s when they were eating a low-fat diet. You know, rice was the majority of their calories. Rice is only 1% of its calories from fat. But they were eating lots of sodium, about 12 to 14 grams a day of sodium. Plus, they were smoking a lot of cigarettes, a stimulant that'll also increase blood pressure. It also leads to secondary elevation of the hematocrit, making the blood thicker because there's a higher viscosity of the blood having a higher hematocrit. More than 99% of the cells in the blood are red blood cells. So if you elevate the hematocrit, that means the number of red blood cells. You make that blood thicker. You got to pump at a higher pressure to pump blood to the top of the head. The main purpose for blood pressure is to pump against gravity to get blood to the top of your brain. So, okay, and the unique thing about that is hypertension-related atherosclerosis tends to be a lot of intracranial atherosclerosis. Okay. So the anatomy here, just real quick. Here's the heart down here. The coronary arteries supply the heart. They wrap around the heart like a crown. That's like coronary for crown. Here is the aortic arch, and then the vessels coming off the aortic arch are the great vessels. There's the right brachiocephalic, goes to subclavian to the arm, common carotid up to the head of the right carotid. Here's the left carotid, bifurcates. Common carotid bifurcates into the external carotid, goes to the face. Internal carotid goes up to the brain. It bifurcates up here into the anterior cerebral and the middle cerebral. We usually call this the ACA, anterior cerebral artery, and the first segment's the A1 ACA. We call this the MCA, middle cerebral artery. First segment's the M1, where it goes upward, M2, where it goes outward, M3, around the convexity, M4. And the reason why you name all those things is then you can describe the location of stenoses and aneurysms. Okay, you can easily remember the anatomy as well by just remembering your ABCs. A for aorta, B for brachiocephalic artery, C for carotid, S for subclavian. So those little mnemonics come in handy if you want to memorize stuff. For most people, they probably don't care too much about memorizing that, but it's good that you heard it once. You know where to go back to find the picture if you want it. Okay, so the SAD diet is a standard American diet, creates that pattern of atherosclerosis. All right, now let's look at a blood pressure here. Blood pressure has the first number, the big number is called the systolic, and the systolic is the number on top. So here's a typical pressure, 110/70 of a normal pressure. Here's a real hypertensive person, 200 systolic, the top number, over 100 diastolic. And the difference between the top number and the bottom number is called the pulse pressure. So this abnormally hypertensive person has a big pulse pressure of 100. A real typical pulse pressure is something like a normal blood pressure, 110/70. So the pulse pressure is going to be the top number minus the bottom number, 40. Higher pulse pressures can damage the arteries of the brain and cause a healing response to that damage, leading to more intracranial atherosclerosis. Okay, in populations where they eat a plant-based diet from birth, they don't ever become hypertensive. That's one of the reasons why epidemiology is so helpful, is because you can just look at an entire population. Nobody's hypertensive, okay? Less than 1%. And so what that means is whatever diet they're eating, it's not causing hypertensive. Versus you go to a Western country like America, and most people, the majority after 50, they're all hypertensive. And a lot of people say stupid things like, I'll talk to a patient and they'll go, oh, doc, my heart disease, it's not diet, it's genetic. I'll go, well, why do you say it's genetic? And the patient will tell me, well, because, I had open heart surgery in my early 50s. My sister had open heart surgery in her 50s. My brother had open heart surgery in his 50s. So it's got to be genetic. I go, no, it's because you all eat the same diet. He said, no, doc, I eat real healthy. Lots of chicken and fish and olive oil. Yeah, a real genius. That's a very highly atherogenic diet right there. Okay, so anyways, And normal pressure is, again, somewhere in the ballpark of 110/70. In general, the lower the number, as long as you feel good. And some people are really healthy. They'll have normal blood pressure 90/60. However, if you take a standard American over 50 and they got a pressure 90/60, you'd be worried that they're in hypotensive shock from low pressure until proven otherwise, until you know what their baseline is. And, you ask them how they're feeling. Okay. Oh yeah, what's the best way to prevent high blood pressure? Best way to prevent high blood pressure is, number one, eat a low-fat diet. The fat makes the red blood cells stick together. I'm going to explain why that is in just a moment, but the chylomicrons will do it, the LDL cholesterol will do it. Excessive obesity is going to release lipids into the blood, so that's going to contribute to hypertension as well. The bigger the body, the more pounds you weigh, the more pumping pressure you need to pump to that bigger, fatter body. Sodium is a vasoconstrictor, which is typically used to flavor processed food and also to flavor meat and preserve meat. Potassium and magnesium, which typically come from plant foods, they're vasodilators, so they'll lower blood pressure. And the greens provide the precursor nitrates. I'll explain all this in more detail in just a moment, but just so you heard it, basically, plant foods optimize your blood pressure. Animal foods and processed foods make it worse. Okay, here's the concept of a Windkessel effect. And Windkessel effect, basically, a Windkessel is like the thing you use, like an accordion it almost looks like, a little bit triangular, to puff air onto the embers of a fire to help restart the fire, the kindling. Okay, so what that means is the ascending thoracic aorta is a second heart. When your heart pumps blood, it pumps it in the ascending thoracic aorta. The pressure of that contraction from the left ventricle, systole means contraction like in Greek, diastole means relaxation in Greek. It causes the ascending aorta to bulge outward when that blood comes rushing in. Now, the ascending thoracic aorta has a lot of elastic fibers. And so once the cardiac contraction is stopped, then they recoil inward. That's called elastic recoil. And that is the effect of a second heart. So during diastole, the elastic recoil generates flow. And so in a normal healthy person, there's not that big of a pulse pressure, meaning not that big of a difference between systolic pressure and diastolic pressure. Over time, over decades of being hypertension, you keep on overstretching these ascending thoracic aorta elastic fibers, and you can't replace them after 20 years of age. So what ends up happening is you lose that elastic recoil ability of the ascending thoracic aorta. That's called the loss of the Windkessel effect. Loss of the Windkessel effect. And once you've done that, now in order to get the same amount of blood up to the top of the brain when you're not generating good diastolic flow, you have to increase the systolic pressure, increase the systolic velocity. Systolic blood pressure goes up. And that has other negative effects. The cardiac muscle fills with blood. So the blood will go into the coronary artery, and then it'll go into the muscle itself, intramyocardial branches of the artery, when the heart's in relaxation. You're not going to get good blood flow into the cardiac muscle during systole because it's contracted. That's going to compress the little arteries inside there, the intramyocardial artery. So the intramyocardial branch is primarily filled during diastole. And that's relevant because once you've lost your Windkessel effect, you've lost your elastic fibers, your ascending thoracic aorta, you need more systolic contraction pressure, a little longer contraction, a little harder contraction, so it's going to be harder to get blood into the coronaries. But the fact that you're contracting more forcefully, you need more blood supply to the coronaries. You see where this is going? You're pushing yourself towards a vicious cycle of contracting longer, stronger, harder, but having less blood to that muscle. So you're putting it at increased risk for ischemia. You're putting it at less capacity to ramp up its pumping power when you're going to be exercising or something. So it's not good. And once they've lost that Windkessel effect, now they're going to be prone to more systolic hypertension. That's also why typical Westerners have much more systolic hypertension after 50 years of age, okay, rather than just diastolic hypertension, for example. Okay. So the ascending thoracic aorta is the second heart. Okay, let's see what's next. All right, now here's an important picture. The idea of red blood cells and their diameter. So red blood cell typically is about 7 microns. You need to know that number. That's going to come up a lot and it's really helpful. So RBC is about 7 microns. All right, typical capillary diameter is about 5 microns. So what that means is the typical red blood cell is bigger than, imagine this is a red blood cell, okay? And it's got to go through this capillary. Okay, it's bigger than the capillary, so it's going to have to deform itself to push through there. It'll fold back on itself. Like this one right here is a little bit folded back on itself. You can imagine if you've got something sticking the red blood cells together, this is a bridging molecule. Like LDL cholesterol is a bridging molecule. That's why increased cholesterol, LDL cholesterol, increases your risk of atherosclerosis, because it sticks red blood cells together. Now you're not just pumping one red blood cell through there. You're like pumping a whole submarine sandwich of them. So pressure has to go up to push that thicker blood through there. So basically, you can imagine pumping something to the top of your head that perfuse the brain. If you're pumping water, your blood's like water, you don't need that much pressure to pump it. But if your blood is thick like a milkshake, you got to pump higher pressure to get that blood up to the top of your brain. Okay, and then bridging molecules, things that stick red blood cells together, that's LDL cholesterol. That's why high cholesterol is a risk factor for atherosclerosis, and also that's why anything that increases high cholesterol, causes high cholesterol, like meat and high-fat diets. Okay, the next thing is increased fibrinogen. Fibrinogen, acute phase reactant protein released by the liver, that's increased with psychological stress. So stress also increases your tendency to clot, and that's the whole mnemonic: being chased by a tiger in the dark. Everything that you would want to happen for being chased by a tiger in the dark, like in case it scratches you, so you're less likely to bleed. It makes your blood more prothrombotic. Okay, but that's not good for being healthy. And that's another reason why caffeine is bad. Caffeine has the same effect. It elevates those same hormones, catecholamines and cortisol, as the acute stress response. Okay, IgM antibodies. That's why infections increase the risk of atherosclerosis and forming clots. And by the way, here's something you have to know. You absolutely have to know this to be able to think intelligently about atherosclerosis. And I can tell you this, 99.9% of doctors don't know what I'm about to tell you. Atherosclerosis is a blood clot. Okay, we'll come back to that, but that's an important point. Atherosclerosis is a blood clot. You need to know that. Once you know that, a lot of things are going to start making sense. Okay, and I can also tell you, when I was a young guy, young doctor, I used to think the best atherosclerosis doctors are the cardiologists, because they deal with atherosclerosis in the coronaries all the time, the vascular surgeons, because they're doing surgery on atherosclerosis all the time, the cardiothoracic surgeons, bypassing atherosclerosis all the time, and the vascular interventional radiologists, which I was doing angioplasties in the lower extremities for peripheral vascular disease at the time. But what I've learned is all those guys are just a bunch of plumbers. They're not the real experts in atherosclerosis. They look at a narrowing, a blockage, and say to themselves, how can we bypass that? We can open it up with a stent, or we can do a surgical bypass distal to the blockage, okay? They're thinking like a plumber. How can we deal with a blockage in the artery? They're not thinking like a scientist, if you will. And so I'll give you an example. A scientist is a pathologist. And the reason why pathologists are the best is they look at atherosclerosis with a microscope, and they go, hey, it looks like a blood clot. It is a blood clot. That's what it is. Okay, and that's highly relevant because once you get that atherosclerosis is just a blood clot, tons of things that previously seemed like a mystery will make sense. Okay, we're going to go through that here. Okay, so here's a guy who's a big pioneer in atherosclerosis research. This guy's name is Gregory Sloop. And so, I did a fellowship in vascular interventional radiology, but there was an emphasis on vascular disease at Harvard back in the 1990s, okay, back when I was a young guy. And I've been interested in atherosclerosis ever since. And I studied it quite a bit. I read almost everything I can get my hands on, all the books, and tons of papers on it. And then I came across this guy's book, and I'm like, holy crap, this is the best explanation I've ever seen by far. So here's the name of his book, Blood Viscosity, Its Role in Cardiovascular Pathophysiology and Hematology by Gregory Sloop. And he's really the pioneer of what you would call the atherothrombosis theory. So thrombus means clot. So atherothrombosis means atherosclerosis is a clot, basically. And he did a lot of work on, even though he's a pathologist, so he looked at it a lot under a microscope, he also did a lot of research on the flow patterns and how they relate to causing atherosclerosis. So this guy, by the way, too, I was so impressed by his work, I contacted him by email, then I even got his phone number and talked to him on the phone because I wanted to clarify. I really wanted to understand atherosclerosis. And after I talked to him, a whole bunch of things became clear to me that previously I was sort of not exactly set on what they were all about. Okay, and he gave me a pretty nice compliment. This guy is the greatest atherosclerosis researcher in the world, and he told me that, he said, in his opinion, I have the best, most comprehensive understanding of pathophysiology and most accurate understanding of pathophysiology of any doctor, of any person in the whole world. That's what he told me. It's the truth. You can contact him, you can email him, you can ask him, okay? He actually just tried to write a review of my book the medical reformation, and he said that Amazon wouldn't let him. So I don't know if that's because he wasn't able to get it to go through for some reason, or they just wouldn't let him. They don't want my book. They don't want the pros knowing about my book, okay? Because once you know about this, you know how to keep yourself healthy. You don't have to be fat, sick, and stupid like most people over 50 and end up sick and spending all your money you got left on the healthcare system. Rather, you can just be healthy. Nobody makes money off low-fat vegans. If everybody was low-fat vegan, healthcare system would go bankrupt. But 99% of patients or more, they don't want low-fat vegan. It gets them all emotionally upset when you mention it. They'd rather go and get their chest cut open with a buzzsaw for cabbage, coronary artery bypass graft surgery, than go low-fat vegan. Okay, let's see here. Oh, here's another reason. Why is it like that? Why is it that the cardiologists don't know atherosclerosis? And the reason is, if you're a cardiologist, you're forced to follow by the rules. What that means is a cardiologist cannot criticize stents. But if you really look closely at stents, they're kind of stupid, okay? You got a 99.4% prevention of recurrent coronary events. You do the Esselstyn diet, low-fat vegan diet, versus you don't even get any noticeable improvement in longevity or decrease in mortality from placing a stent. It can decrease the amount of symptomatic angina, coronary artery stenosis related chest pain, or shortness of breath, lack of energy. Okay, it can improve that, but it doesn't make you live longer, because the stenoses that they're fixing, they're not the ones that kill you. Usually it's the ones you can't even diagnose that end up progressing to thrombus and occluding the coronary artery and killing the patient. So they can't see the problem that needs to be treated, and so what they're treating is really a functional thing, proximal stenoses that are flow limiting and can cause angina. Whoop-de-doo. Now, don't get me wrong, the stent can save your life if you're in the middle of a myocardial infarction, the artery is occluded and they get a wire across and they stent it open. It can save your life in that setting, but that's a rare event. Most of the patients are just chronic, with angina, positive stress tests, that sort of thing. Okay, but what I was trying to say is a cardiologist has to praise stents, or they'll kick them out of the profession. A surgeon can't criticize bypass graft, or they'll be blackballed from their profession. For each coronary artery bypass graft surgery, they're making about $120,000. Do you think some hospital is going to be happy if a surgeon says that cabbage is for the most part for coronary artery atherosclerotic disease kind of a joke compared to Esselstyn diet? No way. That guy would get fired. He would lose money for them. He would lose money for his profession. So they can't be objective about it. Whereas a pathologist, they don't care how atherosclerosis is treated. He could give a rat's tail if it's treated with diet, drugs, or stent, or even therapeutic phlebotomy. As a matter of fact, this guy, Dr. Swoop, the guy's a genius, okay? He really is a genius. His work is amazing. But what he was doing is he was using donating blood to lower his hematocrit, to lower the viscosity of his blood. And I was trying to pressure him to go vegan. He's considering it and making progress in that direction. I told him, anybody who works in healthcare knows the more times you draw blood with that big needle for drawing blood, the more you scar off the vein, okay? And they end up just with a scar there. And I'm like, dude, you're going to just end up with a bunch of scarred off veins, and everybody's going to think you're a heroin addict. I'm kind of laughing because he's a really nerdy, scholarly, super smart guy. It's funny. Okay, here is a Zeta potential, and Zeta potential is something you really need to know about as well. So Zeta potential is, and by the way, these are the great secrets of atherosclerosis, what I'm telling you here. So Zeta potential, and by the way, I can tell you this, every single time that, sometimes doctors will want to follow me around, attendings, residents, fellows, and students, okay? I'm a guy that people like to follow around. So when they come around with me, I always ask them a standard set of questions. And I can tell you, never in my life has any doctor ever, not once out of many hundreds, ever said to me they know what a zeta potential is. So zeta potential is a negative charge on the outside of a red blood cell. And it's been known for a long time. They have to know these things for when they store blood, okay, for blood transfusions and stuff. But it never gets taught to medical students or residents. So there's a negative charge on the outer surface of a red blood cell, so that the two red blood cells will repel each other. They don't stick together, and that's good. That's what you want, so you don't form clots, okay? A bridging molecule is a molecule with a positive charge on its outer surface that will stick the red blood cells together. That's called overcoming the zeta potential. And like we just spoke about, LDL cholesterol will do it. Positive charge, big enough, sticks them together. IgM antibodies big enough, it'll stick them together. That's why you'll have increased incidence of arterial thrombosis, venous thrombosis in the setting of an acute infection. Okay, fibrinogen. Fibrinogen is the clotting protein released by the liver, also as an acute phase reactant in the setting of inflammation, for example, also released with stress, and it's prothrombotic. Okay, and the other thing too, leaky gut will cause postprandial endotoxemia, meaning that some bacterial endotoxin from gram-negative bacteria, LPS, lipopolysaccharide, from gram-positive bacteria, LTA, lipoteichoic acid, they get into the blood, and they will interact with the fibrinogen, making it. I'll talk about this in more detail later because it's a little bit of a complex subject, but the gist of it is they change the shape of fibrinogen, making it even more thrombotic than it normally is. And that leads to what's called amyloidogenic clotting, and that's an important thing to understand. So you want to file that concept away. Infections not only can increase clotting through IgM antibody, but there's a second special set of issues where you can get amyloid-like clotting due to amyloidogenic distortion of the fibrinogen molecules. I'm going to go into that more detail. I know I'm throwing a lot of big words at you, but okay, that's why this is the greatest medical book ever written, because I'm taking you places you can't go in the standard medical textbooks. You could go up to the chief of of medicine at one of the Ivy League schools, and they won't know all this stuff, all right? Because it is simply not in the medical literature unless you are like a research specialist for these things, okay? I didn't learn any of this from medical books. You can't find it in any of the medical books. I have multiple copies of the different versions of the common medical books, okay? And it's not in any of them, okay? Zeta potential, super important. So what creates a zeta potential? Well, you can get it from sialic acids. That's got a negative charge. You can get it from cholesterol sulfates. You can also get it from heparin sulfates, okay? I'll show you just an example of a sialic acid. So sialic acids, think of them as just being like glucose with a carboxylic acid there added onto it. There's a little more to it than that, but that's all you need to know. So here's a glucose, here's a carboxylic acid. You stick that on there, it becomes deprotonated in the blood at physiologic pH, and now you got a negative charge. All right. So that's one of the things that helps red blood cells generate a zeta potential. And then here's where it gets even more interesting. It's not just red blood cells. All the cells in the blood have a zeta potential. The white blood cells too. And guess what? The glycocalyx, meaning the sugar coating, the surface proteins and whatnot, glycoproteins on the surface of the endothelium, the arterial lining cells, they've got a zeta potential as well. Everything is negatively charged, so it's like bumper cars. Nothing sticks together. That's what you want. Okay. Oops. All right, now I'm going to show you something this is something from Dr. McDougall's YouTube channel, and it's a video that was made by Roy Swank. He's a neurologist from Canada, and then he ended up working in Oregon. He's the guy who has the longest follow-up in the world, the best results of any doctor in the whole world for the long-term treatment of multiple sclerosis. And what he noticed was that meals high in saturated fat would tend to produce a lot of chylomicrons immediately following eating that would stick the red blood cells together. And so he did some videos. This was done, I think, in the cheek pouch of a hamster, but they've done these things underneath the tongue in humans. They've looked at the eye postprandial. Postprandial means to eat, so postprandial means right after eating. And they looked at the eye in humans underneath their tongues, and there's even been some experience where people have looked at vessels in the abdomen, when it's opened up for certain reasons. Okay, so anyways, what they saw is the red blood cells all start sticking together. So this video shows normal blood flow before a meal, then following a high-fat meal, you see all the red blood cells sticking together like a submarine sandwich like I was talking about, meaning that pressure has to go up and that it's harder for them to get through the capillaries. There's also a drop in oxygenation. I think it was a Peter Quo paper. He's a cardiologist from Philadelphia back in the 1950s and 60s, and he showed a 15 to 20% drop in tissue oxygenation after a high-fat meal. Okay. Roy Swank even showed in the hamster brain a 35% drop in oxygen in the hamster brain cells following a high-fat meal. And that's a big deal. We'll come back to that when we start talking about cancer, but when you're talking about that big of a drop in tissue oxygenation, you're increasing the risk of what is called hypoxia. So hypo, H-Y-P-O, means decrease. Oxia is oxygen. So hypoxia means decreased oxygen. Okay, and that can be a real big problem for brain cells, especially if you think about it. There's baseline atherosclerosis due to hypertension, due to diabetes. All right, all these things add up. All right, but anyways, this is only 50 seconds long. I strongly recommend you watch this movie. It's called Blood Sludge, Blood Flow Before and After Eating a Fatty Meal at the Dr. McDougall Health and Medical Center YouTube channel. Okay, you're going to remember it the rest of your life. I can tell you, this is like one of the most impressive things. I show this to doctors like, wow, that's a big deal because it just makes it obvious what a big effect food has on blood flow. And if it has a big effect on blood flow, that means it's affecting a lot of other things. Everything in your body works better with good blood flow. So something that messes up your blood flow is a big deal. It's going to decrease healing. It's going to decrease your energy. It's going to decrease the function of that tissue. It's going to increase the risk of cancer in many settings. We're going to talk about the Warburg effect in the chapters on cancer. Okay, so when red blood cells stick together, you can call that rouleau formation. Rouleau is the French word for stack of coins. Okay, you can also get a blood sludge effect where it's stacking the red blood cells together from the chylomicrons. That's part of the system of absorbing lipids, absorbing fats after we eat a meal. The higher the LDL cholesterol in the blood, the higher the blood viscosity. Let me get that picture in a little bit better focus there. Okay, so blood viscosity means the thickness of the blood. That's the medical word for thickness, viscosity. The thicker the blood, the more it is prone to clotting. That's bad. Okay, there's another word that sometimes comes up is if you have 2 cups of fluid, one of them is water. Let's say this is water. Water is a Newtonian fluid, meaning that it's the same whether it is at rest or moving. Blood is what is called thixotropic. Thixotropic just means that when it's moving, it's lower viscosity. It's thinner, if so to speak. But when it sits, it starts to clot. It starts to aggregate, and it becomes thicker. And so that's a bad thing. It's another reason why stasis is bad. Why people are more likely to get a blood clot in the veins of their legs if they're sitting on an airplane flight that's 10 hours long or something. Okay, but you need to know this because there's a lot of BS artists on the internet trying to say that cholesterol doesn't increase atherosclerosis risk. That's completely untrue. It definitely increases atherosclerosis a lot. As a matter of fact, William Roberts, the world famous expert on atherosclerosis, said the most important cause of atherosclerosis is elevated blood cholesterol. One of the things they confuse people with is if you look at total blood cholesterol, they're going to tell you below 200 is normal. Average American is about 220 or so, 220 total cholesterol. But the problem with that is to tell you that below 200 is normal is stupid. That's a normative standard being taken from a high cholesterol population. Okay, really what you want is to have a total cholesterol below 150. That's based on data from the Framingham study. That's based on data from the Esselstyn study and his work, from Dr. Ornish's research on atherosclerosis, and from the atherosclerosis research related to the China study, from the book written by T. Colin Campbell and the papers related to that. There were some provinces in China that had total cholesterols, an average for the entire province, less than 95. Okay, I'm a low-fat, low-sodium vegan, and my total cholesterol tends to bounce between 90 to 140, just for, reference, okay? Some examples. And they showed this, Ansel Keys showed this back in the 1950s, okay, that cholesterol was a major risk factor for atherosclerosis. Okay, now I'm going to talk about something that's a little bit of a hot topic recently, and this is something called LP little a. Okay, LP little a is this particle right here. So here's an LDL cholesterol particle. LP little a is just a glycoprotein attached to the LDL cholesterol. So the LDL cholesterol has a protein on its outer surface. It looks like a baseball. Okay, you got this big fatty mass, and then you've got the seams, what looks like the seams of the baseball, the apo-beep lipoprotein on the LDL cholesterol particle. They are attached to this LP little a particle. Okay, and the significance of it is it's sort of similar to plasminogen, and it's almost like a competitive inhibitor of a clot-dissolving protein. And because it's inhibiting the clot-dissolving protein, it makes the blood more thrombogenic. Thrombogenic means thrombo means clot, genic means to cause something. So thrombogenic meaning to cause clots. So higher levels of LPA increase the risk of a person clotting. Dr. Sloop did research on this, and his belief is that it's, like I said, a duplicated gene that's become mutated. A duplicated gene of plasminogen that became mutated such that it's dysfunctional, and it ends up functioning as an inhibitor of plasminogen, a competitive inhibitor. So that's a significance, and that also explains why it can be a variable length. because something that was important wouldn't vary much in size, but that explains how it can vary in size. Oh, but if you manage your lipids well by being a low-fat vegan, you probably won't have any problems, because up to 20% of people are thought to have elevated LPA. But you know what? Almost nobody. Like Esselstyn has a 99.45% success rate in preventing cardiovascular and thrombotic events for people who follow his diet over the course of 4 years. And so lots of those people must have had elevated LPA. There's more to know about it than that. I made some online videos about that specific topic, but we're not going to get into that anymore here today. But that's the good news, is that even if you got one of these lipid problems, you're probably going to be just fine going with the low-fat vegan diet. And I've heard in lectures Esselstyn say that, yeah, somebody follows a diet, they usually tend to do pretty well, even if they keep maintaining a relatively high blood cholesterol. That's just sort of the way their body sets its baseline. They still do pretty well if they follow the diet. Esselstyn's sort of famous paper is the July issue of Family Practice from 2014, if you want to look that up. You can go to his website too. Just go to dresselstyn.com. You'll see all this stuff. Here is blood flow. And here's like laminar blood flow. So it should be like your fingers on your hand. In the center is the red blood cells that's going along at the fastest speed. Then are the white blood cells, the fingers adjacent to that. Then your little thumbs right there, those are like the plasma. So the plasma is on the outside, these black arrows, and that's in contact with the glycocalyx of the endothelium, the lining cells of the arteries. Okay, and this is a good thing. So the plasma doesn't clot, so the plasma is less likely to clot with the it's just a good way for blood to flow. It's called laminar flow, meaning it's like a parabola, this the leading edge of the blood as it's coming in. Okay. This is going to be important in a sec, because laminar flow is what your body wants. Okay, that's what your arteries expect. And so let's talk about what happens when you disrupt laminar flow. So when blood comes to a bifurcation, I'm drawing this, for example, CCA, common carotid artery in the neck, but this could be any bifurcation in your coronaries, etc. Blood comes up, it hits the median divider, you know what I mean, sort of like just the physical space between the branch points, the external carotid artery here, internal carotid here. And then it bounces off of there, and you'll have some turbulent flow or chaotic blood flow. You'll also get some retrograde blood flow along these endothelial cells. And what happens is if the pressure is excessively high, like a very high blood pressure, very high systolic pressure, it bounces off to this area more forcefully, and so you get more turbulent flow. You get more retrograde flow. Retrograde flow is also called eddy currents for retrograde flow. And the relevance is these confuse the arterial lining cells, the endothelium, and they'll start to shed their antithrombotic glycocalyx of all those negative charges, generating a Zeta potential, heparin sulfates, sialic acids, cholesterol sulfates, and then they'll have expressed these prothrombotic molecules, things like VCAM, vascular cell adhesion molecule, for example, and you'll start to form clots there, and you'll end up in a steady state between forming clots and dissolving clots, and that's basically a blood clot is now formed on the arterial wall. It typically occurs right here at the site along the internal carotid artery opposite the bifurcation. So the coronaries have tons and tons of bifurcations. In the neck, there's only one bifurcation of the blood vessels that are going to go up to the brain. External carotid goes to the face. Internal carotid artery goes up to the brain. So that's it. This is just a bifurcation. Common carotid bifurcates. That's it. All right, so anyways, you'll form a clot here, and then you'll be in a steady state between making it bigger, making it smaller, and it just ends up staying about the same size, typically, unless you do some big change in your behavior. All right, but the point is made. This is why atherosclerosis, you see the sequence of events here? First of all, you lose the Windkessel effect from chronic, relatively mild hypertension, and then you have increased systolic flow, so you keep hitting this median divider at higher and higher pressures, all day long, every day. And then you start forming clots and the far wall away from the bifurcation point. And eventually, as the person gets older, they start losing the ability to keep up with clot formation. Clot formation starts to occur more rapidly than clot dissolution, so that this will get bigger and eventually potentially occlude this vessel, but more commonly, little pieces will break off and cause a stroke distally. When a piece of a clot breaks off and moves distally within the artery going with the blood flow, that's called to embolize. So you get embolization of clot. They'll call it embolization of atherosclerotic plaque, but it's really embolization of a clot. When a clot is chronic, it becomes what is called organized. And organized means that, macrophages come in there, the big cells, macro meaning big, phages to eat, so big eaters. And they'll try to reabsorb some of the lipid, some of the necrotic tissue within the clot. But anyways, little pieces can atheroembolize distally to the brain and cause small strokes. If a big piece embolizes, that can cause a bigger stroke. And the older the person gets, the less able they are to keep up with this clot formation. Okay, little things are happening too. You got endothelial precursor cells that circulate around in the blood, and they cover up the clot, and that's how it becomes subintimal. Because you read a lot and you'll hear a lot. How does atherosclerosis plaque become subintimal? Well, that's how it becomes subintimal. Circulating endothelial precursor cells, I usually call them EPCs, endothelial precursor cells, cover up the clot, and so now they form a new intima, a neointima, and thus the clot is subintimal. Okay. Glyco means sugar, calyx means coating, so the coating on the attached to the plasma membrane of your endothelial cells and your red blood cells and your white blood cells is called glycocalyx. Okay. All right, here's going to show the surface of a endothelial cell. Let me see, what am I doing for page numbers here? Actually, I'm right about time to take a break. Okay, so we'll make this the end of chapter 10A, and then I will start talking about endothelial cells in the next section, which will be called chapter 10B. So I hope this is helpful and interesting for you.